Hello, everyone. I'm Nazlı Sönmez. I recently started working as an assistant professor at Bilkent University in Turkey, and I'm a former PhD student at London Business School. Today, I will talk about my work on shared service deliveries by focusing on a shared medical appointment setting. And this is a joint work with my former advisor, Kamalini Ramdas from LBS, and Ryan Buell from Harvard Business School. Before we start, I just want you to think your last doctor appointment, and it must have been one-on-one, as we see here in this picture, and you may have received one-on-one attention during your diagnosis and prescription while there was no one else in the room, only you and the doctor. However, there is an alternative for that, which is called shared medical appointments. As you can see from this picture, there can be 5 to 15 patients, other patients, who are suffering from similar diseases with you. And they can also listen while you are getting your examination, getting your prescription and diagnosis, which is done by one-on-one interaction with the doctor, while others are also existing in the room. So you can just share some ideas with these people in the room. You can discuss some issues together, share your experiences. And in the end, maybe you can become friends with these people and come to your appointments together, or just chat about your disease in the later stages of the appointment. And shared medical appointments is a kind of shared service delivery. And we are also very familiar with other kind of shared service deliveries, which are similar to shared medical appointments. For example, conferences are typical examples of a shared service delivery. I wish we had a chance to also sit in the same room and interact this time, but normally in a conference, we don't only learn from the presenter, we learn from each other, because sometimes there's a contribution from our peers and we create collective knowledge together in the same room. Similarly, in the classroom, we learn from professors, teachers, and also from the peers. And again, there is a collective knowledge created together in the same room. And there are already some theories in psychology and sociology stating that due to Kohler effect, people work harder in the group settings compared to being alone in what they are doing. And there is a famous sociologist, Randall, and his theory about group interaction rituals, saying that if there is a successful group interaction in any setting, it creates collective happiness and mutual focus. And operational transparency literature also shows that if you have a chance to see how service provider is behaving towards other people in the room, in your service setting, you are happier and you are more engaged in your service. So all these theories are saying that you can make customers more active rather than being passive by applying a shared service delivery. On the other hand, there are some beliefs and just like arguments stating that there can be loss of personal connection, there can be diminished confidentiality in shared service deliveries because there can be a privacy barrier. All these things are understandable, all these theories, pluses and minuses about shared service deliveries and its relationship with a customer engagement. So to explore this trade-off, we decided to conduct a field experiment with in a hospital setting, which is more conservative and hard to apply this setting. So we decided to do this to test the efficacy of shared medical appointments as a type of shared service delivery, as a lever for increasing the patient engagement. And to be able to do that, we decided to do a randomized control trial with 1,000 glaucoma patients. Shared medical appointment idea is actually existing for more than 10 years, and it's applied by some hospitals in US. However, the existing studies are generally medical studies, and they are more observational type of studies. So as you can expect it, they generally suffer from some selection problem. Patients are just like choosing themselves to join shared medical appointments. So to provide some rigorous evidence on the benefits of this method, we decided to conduct a perfectly randomized control trial with 1,000 patients. And we conducted our study in southeast of India in a city called Pondicherry here, and with an hospital called Aravind Eye Hospital. Aravind Eye Hospital is world's largest blindness prevention care center, and it has 11 branches across all south of India. And we work with their Pondicherry branch, glaucoma clinic, and glaucoma volume of Aravind Eye Hospital is huge. They have 1,000 glaucoma visits per week. So their huge volume help us a lot for assembling our groups and also scheduling the later stages of the appointment, as I will discuss now. Let me just show you our design, how we conducted our randomized control trial with this time limit. So in our study, after getting an informed consent from the patient, we randomly assigned half of our study patients to one-on-one condition, half of them to the shared medical appointment condition. If a patient was assigned to a shared medical appointment condition, he had to continue with 3 more shared medical appointments, and which are 4 months apart from each other. And if a patient was assigned to one-on-one, similarly, he or she needs to continue with 3 more one-on-one appointments, which are 4 months apart from each other. And with this study, we measured how engaged our patients during each of their appointments by looking into their total speaking behavior, questions per minute, or just their answers, their non-question comments, and also some non-verbal engagement measures by looking at their gestures, mimics, and how they behave during the appointment. Before going into that, we also measured some different outcomes, such as patient knowledge, satisfaction, compliance, and also lateness of those patients. Because of that, we decided to use a multi-stage trial instead of just observing one appointment of the patients, because as you can expect, that some of the behavioral outcomes takes long time to observe. And as a result of this study, we conducted our data collection process for 3.5 years. So my PhD was full of this data collection process and trips to Pondicherry, India. So this is a struct. If you just want to imagine how a shared medical appointment versus one-on-one appointment looks like in our study, this is the just visual version of shared medical appointment. It starts with an introduction period where everyone is welcomed and sit themselves in the same room. And then there is one individual examination of the first patient, and a patient comes in front of the doctor while others are again sitting in the room, and just like he or she gets individual examination, and doctor asks about compliance behavior or family history after that, because glaucoma is a hereditary disease. Then doctor just goes to next patient, and next patient comes in front of the doctor. After all individual examinations are done, there is a group interaction stage, which is this one, and a patient poses a question or a doctor says something. So there is basically a group discussion at the end of a shared medical appointment. And similarly, in one-on-one, there is an introduction stage. This is the picture of 5 consecutive one-on-one appointments. So this is one-on-one. There is only one doctor and one patient in the room. And it starts with introduction. There is again individual examination. It is exactly the same with individual examination part of shared medical appointments in terms of the content. And in the end, there is also a post-examination interaction where a patient can pose a question and doctor answers. And then there is a change over time because first patient leaves the room, then the second patient comes. So 5 consecutive appointments, one-on-one appointments, looks like this, versus there is shared medical appointment in our study. If you are assigned to that arm, you are going to shared medical appointment. And one interesting thing is here is our shared medical appointments took longer than one-on-one appointments. If you think about the total duration of 5 patient shared medical appointments versus consecutive one-on-one appointments of 5 patients. And this is not the case in US, because as you can imagine, they are also used by time saving or cost saving in the US in some hospitals, such as Cleveland Clinic, Cooper Hospital. The reason for our result was because of the fact that Aravind Eye Hospital is more patient-centered, and they are trying to give the importance of just like their importance is health of the patients. So as a regular practice, they are not giving certain duration for their medical appointments. They are just giving a day to the patients. So, and then they finish the appointment when the discussion is over. So we didn't want to change their regular practice, and we did want to just apply what they are doing to be consistent with in our study. So in shared medical appointments, discussions were longer, and then they stopped, I think, later stages of the appointment. During our study, we had a chance to videotape all one-on-one and shared medical appointments in our study. So it provided us 20,000 minutes of video, which is a very rich data set we had. And we worked with a transcription agency so that we got the English transcripts of all these appointments with some timestamps and gestures and mimics. So when we got that data about verbal engagement, we first looked into a cumulative number of questions asked by a group of 5 patients in SMA versus one-on-one. And we saw that after some point, the red line shows the shared medical appointment. Shared medical appointment patients are asking more questions than one-on-one appointment patients, as you see here. And even if you truncate it, even if you stop shared medical appointments at mean duration of 5 consecutive one-on-one appointments, shared medical appointments produced more questions. So this is just giving some clues about the promise of the shared medical appointments, about making appointments more patient-centered, and patients are asking more questions. And in terms of nonverbal patient engagement, we also collected some data from the transcription service about how attentive patients are, how positive, to what extent they are doing head wobbling, which is talai talatam in Tamil language. And in India, it represents appreciation, approval as a gesture. So we looked into eye contact, leaning in, end of appointment happiness. And this is the example sheet we got from the transcription service. And as a result, when we looked into the verbal engagement data, we found that in shared medical appointments, patients are talking more, they are asking more questions, 37% more questions, and they are making more non-question comments, and they are answering more questions. And we were also interested in the moderating effect of the examination order of the patients on different verbal engagement measures. And we saw that if the patients are earlier at the examination stage, they are more talkative, they are talking more, they are asking more questions compared to, again, one-on-one appointment patients. And this trend is similar in verbal engagement measures we see here. We also saw that from doctors' engagement level, actually, doctors are speaking more in shared medical appointments, and they are asking 3% fewer questions while making 11% more non-question comments and answering 38% more questions on a minute-by-minute basis. So overall, with the previous picture and these results, we can still see that the appointments are more patient-centered in shared medical appointments, and patients are more willing to ask questions. They are willing to learn something instead of just replying to what doctor is saying. So this is promising. And when we looked into the nonverbal engagement measures, we also saw that patients are more attentive, more positive, doing more head wobbling, doing more eye contact, and also they are happier at the end of the appointment in shared medical appointments compared to one-on-one appointments. Then, to conclude, I can just say that shared medical appointments are definitely a powerful way to improve both verbal and nonverbal engagement of the patients. And in our randomized control trial, by randomly assigning patients to experience shared medical appointments, we saw that they participated more in conversations, asked more questions, made more non-question comments, and they provided more answers to the questions asked by the doctor. And they exhibited higher nonverbal engagement levels. In addition to that, doctors who experienced shared medical appointment asked fewer questions, and they answered more questions. So our results are actually not limited with patient engagement from this study. In a separate paper, we are showing that we decreased the non-compliance rate of the patients by 40% by doing shared medical appointments. And we are believing that to the extent this method is working to increase patient engagement and different patient outcomes, it can also work in other service settings where shared delivery is applicable and beneficial and where customers can learn from each other and share similar concerns. And I just want to conclude with just like exciting news about our study. There are a couple of HBS MBA students who got inspired from our study, and they started a startup, and they recently got a very good amount of funding. And their name is Seventh Starling, and they are providing prenatal care and postpartum care in a shared appointment setting in a virtual environment. So they started their company during the COVID, but now they are still continuing doing virtual service. And yeah, they're going very well. And the final news is Dr. Soumya Swaminathan, who is the World Health Organization's chief scientist. She recently visited Aravind Eye Hospital, and she highlighted the importance of this kind of shared service delivery methods in healthcare, and how they can help to just like solve the problem of supply and demand in developing countries, and how it will help the healthcare system of the developing countries overall. That's all I want to say. Thank you so much, everyone, for joining us today.